Today we have with us Simon, who's a second year grad med student at Cambridge. Hi Simon, thank you for being here today.
Hello, thank you.
So if you can just get us started by sharing your journey to medicine. What have you been up to on your way to the course?
Yeah, so I didn't initially apply for medicine when I left high school. I applied for a mixture of pharmacy and maths, and I didn't really know what I wanted to do. I had a bit of a random mishmash of A levels. I did chemistry, maths, French, and music as my four subjects. So yeah, I studied at the University of Strathclyde. I studied pharmacy, trained as a pharmacist. I worked in hospital pharmacy initially for 2 years, which I absolutely loved. But I think it's always good to look at your sort of future, like what could your potential future role be? And even though I really liked my role, my job, I looked at my seniors and I sort of thought, is that where I want to be in 10 years time? And I sort of thought to myself, well, no, not really actually. And I couldn't see any real progression there. So I decided to leave that job, even though I really liked the clinical pharmacy, like it's such a great profession. I decided to leave my role and I decided to try and pursue other opportunities. But I got tied in. I started locuming. I did community pharmacy locums, and I ended up being offered a management post in a community pharmacy, which I really loved. I really loved the rapport that you sort of can build with patients coming in, diagnosing minor ailments. But I knew ultimately, like, it wasn't what I wanted to do. I couldn't see myself still in that position or even going down the sort of management aspect of that in 10 years' time. So I sort of looked at my things that I enjoyed from my pharmacy career in hospital and from community pharmacy, and I sort of thought, well, I really enjoy the clinical side of things, and I sort of missed that a little bit from community pharmacy. Even though you do a bit of diagnostics, it's not the same as having the full breadth of information that you can get in an acute setting in hospital. And I really liked the patient contact that I was getting and the little consultations, the medicines reviews that I was doing in community pharmacy. And I got some experience shadowing some doctors, and I went to theatres, and I just decided, look, medicine really does put together the aspects that I enjoyed from both aspects of my career that I've had so far, and I can see 10 years down the line the opportunities are more diverse and sort of endless. So I worked for 4 years after university before I actually decided, look, I want to become a doctor. So it did take me that little bit longer, but I'm really glad that it was sort of my decision, and that I was at a point in my life where I was probably more, you sort of know yourself a little bit better, you're more mature, and I don't know if I would have had that maturity at the age of 18. So I think I was more sort of mature and ready to study.
Yeah, I think it's hard as well to know what the job entails, or any job really, unless you've got, experience and I suppose working in a linked environment, you were able to really observe what being a doctor is like. But it's really hard to get that, especially, at school at 18, you just don't have those opportunities. So how are you supposed to know if it's something you're going to enjoy?
Yeah, definitely. I mean, when I was in sixth form, I did consider applying at one point to medicine. But I realized that it is something that at the time I remember thinking, wow, this is such a vocation. You have to dedicate so much of your life, and I don't know if I really want this enough to want to apply. So I just decided, well, I'll put that idea to one side, just because I don't think that I know this is such a vocation that I don't really know if it is for me. And I think I was right at that stage, that it is such a vocation that you have to really, really want it, and nobody else can really push you into that. So yeah, I think, but I think you're right, like working in a sort of allied health profession like pharmacy, I worked really closely with doctors, and often I think when I was going through patient notes, I was more interested in the diagnostic side of things, and I would sort of chat to my doctor colleagues and say, oh, why are you doing this test, and what does that mean? And I think like if you are in a position where you're like if you're a pharmacist or training to be a pharmacist, then and interested in medicine, it like ask the doctors around you like what they're doing, because I think within medicine, like doctors always want to teach you, like it's such a teaching and learning profession. Yeah, and when I was in my pre-reg year, I got the opportunity to go and observe some surgeries and things. So you're in such a great, I was really fortunate that it was such a passive way to get work experience in some senses, but also put yourself out there. If you see a procedure, just ask, oh, can I come and watch maybe? And yeah, I think that you're in such a privileged position if you're a pharmacist or a trainee pharmacist. Yeah,
I suppose, or any positions, you know, HCAs, as long as you're not compromising the role you're supposed to be doing, then I think show an interest, people will really jump on the chance to share, because it's their passion really, isn't it? It's their job. And I think it allows you to, I suppose, find where your curiosity lies. You know, if you, like you said, you were drawn to the more of like the diagnostics, but you can be having access to that environment, you can see where what takes your interests and more. So I think, utilize your positions and take the experience you can is excellent advice. So going a little bit back to your first degree, so what made you choose pharmacy out of your options at undergrad?
That's a really good question. To be honest, I'm not really sure. I really liked chemistry and maths, and I guess I enjoyed the idea of doing something practical, something that I could be helpful in, and that I could potentially get a job in down the line. So I applied for pharmacy because a careers advisor at school said, oh, maybe you should choose pharmacy. And it was a bit random, to be honest. I don't think I really thought too much about it. I was lucky that I really enjoyed my degree, and I really enjoyed the city that I studied in. I studied in Glasgow at University of Strathclyde, which was such a great course, and I had opportunities to do research and stuff abroad with them. So it was brilliant.
So did you do like a year abroad within the course?
I didn't do a year abroad. We had a connection with a university in Malaysia, the International Medical University. So I had the opportunity to spend 3 months over there doing a research project in a lab. So I was doing I was in a synthesis lab, making things out of palm oil, and I know that's I can't even remember all the details of it, but we were making an antifungal, and it was really great. And I got to, for my final year project, I got to do some more lab work. I was working with like symbiotic bacteria and marine sponges, and I got to do lots of hardcore science, which was maybe a bit unusual for a pharmacy degree, but I really enjoyed it. I think I concluded at the end of my degree, though, that maybe I didn't want to work in a lab for the rest of my life. But I was glad that I sort of had that experience, and like I really did enjoy the sort of research that I got to do.
Maybe career in academia, not so much in the future then.
Yeah, I mean, I wouldn't rule it out as sort of like a sideline. I am really interested in science. I think that like the Cambridge course really does sort of promote that interest. But yeah, I don't think that it's going to be my main thing.
Yeah, I think I can understand that. Okay, so thinking about move towards medicine then and the application. So were you working at the time of your application? Like, how did you find that whole process?
Yeah, to be honest, it was quite exhausting. I was managing a pharmacy at the time, and it was quite hard, sort of even not telling my colleagues that I was going to the library in the evenings to sort of study for the entrance exams or prepare my personal statement. So yeah, it was quite difficult from that aspect, just sort of not telling everyone. I think yeah, so I did the UK CAT, and I probably didn't spend enough time preparing for it. I got the like UK CAT preparation book. I did a few of those questions here and there, never really timed, and that sort of reflected in my results. I didn't do very well. So I think I sort of changed tack a little bit, and I decided, right, I should probably do the GAMSAT. And I put in a lot of work in the evenings for the GAMSAT. So I was going to the library every evening, bashing out past paper questions and practicing essays and things. And yeah, that was quite a lot to manage, working full time and having quite a responsible role, and doing all that. So I did a little bit better in my GAMSAT than the UK CAT. I think I was still quite cut off. I was on the borderline sort of marks for the cutoff marks for uni. So in the end, I decided to apply for was it 2 GAMSAT unis and then Cambridge, which didn't have any admissions, and then 1 UK CAT uni. So I applied to Bristol, who rejected me immediately because my UK CAT score wasn't very good, which was probably an error on my part for applying there with a bad score.
Yeah, it's hard to know. The admissions like can slightly change what the cutoffs are each year. So I think there's an element of applying strategically, but then also, you have to, I suppose, factor in that it might change a little bit in the applications. So it seems like you did quite a spread then across different exams. So for Cambridge, if they don't have an entrance exam, what sort of things do they look for? Do they ask for in the application?
Yeah, so for Cambridge, you need you can apply with any degree from any discipline. So it doesn't necessarily have to be an experimental science degree. You can apply from an English degree. There's actually a guy in my college who's got an English degree, another one with classics, but then there's several people with like science PhDs. So there's quite a diverse range of people that apply, but yeah, there's no specification that it has to be science. You need a 2-1, and you also need A-level chemistry sat within 7 years of applying. So I actually didn't have A-level chemistry within 7 years, but before I applied, I emailed all of the grad medicine colleges. So there's 4 grad med colleges.
Okay.
And I emailed all the colleges and I said, look, I've done A-level chemistry 8 years ago, but my undergrad degree had a significant component of chemistry. So a few of them emailed me back and said, well, that's okay. If you can send us your transcripts and module descriptors, and then sort of map up how your degree corresponds to the A-level chemistry course. And it took a while to do. It maybe took like a few hours to collaborate all of that into a PDF, but it was definitely worth it.
So you apply obviously through UCAS, but do you have to nominate a college? So did you have to decide your college at the same time as deciding to apply to Cambridge?
Yeah, so you can either put in an open application, or you can apply to a specific college. There's only 4 colleges that do grad med. I should have said, in addition to UCAS, so you do your personal statement on UCAS, and then there's a separate application form for Cambridge, which all they ask is you to put a bit of work experience down. So I think just put whatever work experience you have on that. For instance, I think some of my work experience was a little bit tenuous, and like it wasn't directly medical, but it all depends on how you sort of sell it as being medical work experience. For example, my grandmother was in hospital, and I looked after my granddad for a week, and he had quite severe dementia. So I wrote that down, the challenges of that and what I'd learned from it, and yeah, just anything that is remotely medical. I also wrote about I did a summer school. I was an English assistant at a university in Tunisia on one of my summers of uni. And there was an outbreak of food poisoning there. And we realized this all culminated when we were doing I think I was leading a quiz, like a pub quiz type thing, and one person fainted and screamed and was writhing around on the floor, and then all of them started fainting. And I wrote about this on my thing. So it doesn't sort of like the mass management of that emergency sort of situation. And I think it doesn't matter for them if you've certainly not all of my things that I wrote down were really medical, but I guess it just depends on how you sort of phrase it as well. So yeah, they asked for your sort of medical related work experience, and then just you also have to get another reference in addition to your UCAS one.
Yeah. I think that's helpful advice, because I think you don't necessarily find that out until you start going through the process of applying, and some of the schools have different requirements, so it's quite hard pulling that all together.
Yeah, definitely.
Perfect advice about the sharing your experiences. It's all about what you've learned from it and the reflection of it, and I suppose saying what you did well in that scenario, managing people, showing leadership. I think you can take some scenarios which are a bit left field and really make them work. So
yeah, definitely. And I know that certainly I had quite a lot of actual experience in a medical setting, but I know others within my cohort who had significantly less, but were able to show through transferable sort of more left field experiences that they had traits that would be suitable to being a doctor. And I think they score your application based on it's 50-50, so it's 50% your personal statement and your work experience form. And then if you get called to interview, then it's a cumulative score, so that gets added on to the score from your application.
Yeah, okay. And obviously you can't talk too much about the interview, but is it MMI or is it traditional?
Yeah, so the interview was MMI. It's a weird mash of MMI. There's some sort of stations that are sort of more typical Cambridge interview that ask you more sciencey questions, and then other stations are more sort of what you would expect from an MMI interview. So I guess bear that in mind, that they might ask a few more scientific questions that you might not expect. But yeah, I think Cambridge does like to focus on they like to emphasize that they are more sciencey. They do have a stronger research sort of focus.
Yeah, I think I've heard that before, and in contrast to I suppose my experience with the Bristol interviews is you've done your UK-CAT, or like you've got your academics. They want to explore more about, I suppose, you as your motivations and you as a person, and as opposed to the academic side. So I think it's definitely good to know going into the interview. Obviously there's limited preparation you can do, but I suppose the mindset of not being thrown by a science question when you're expecting to explore your work experience, or talk about working in a team, or things like that. So
yeah, definitely. I think like their interview, their little mini interviews, they're supposed to emulate a supervision in some ways. So they might give you a piece of information, and they're not expecting you to be an expert on this topic because you haven't studied the course yet. But I think they just want to know how you think and whether you would thrive in that. So in Cambridge, we don't call small group teaching tutorials, they're supervisions. So they sort of want to see whether you would, how you would cope with that sort of teaching. So, I mean, I left my interview, I quite enjoyed the interview because I went away having learnt a few things. And my advice for the interview would be verbalize your thoughts. I know this is probably good for any interview, but I find in particular for the science questions, say what you know, state the obvious that's in front of you, because they want to see how you think. And if you are in a supervision, in a small group teaching, just the people who stay quiet don't really contribute to everyone else's learning. Just state out loud the obvious things, and slowly you'll have a back and forth with the interviewer, and they might teach you something. And my advice is, when they told me something that I didn't know, I just acted really interested in what they were saying. Which might have worked.
Yeah, well, obviously worked. I suppose it shows a confidence as well to be able to talk to someone under interview environment. It's stressful, you're talking to someone you don't know who's in a high position, and to be able to just have the confidence to share your knowledge, I suppose admit where your gaps are as well, what you're not quite sure on, and then accept some learning. It's like, again, it's those, I suppose, transferable skills and how you work, because it seems to be more and more courses are moving towards a very collaborative working environment. So your supervisions, or we have CBL. I know CBL and PBL is a big learning style now, and they do require, I mean, the better the contribution, I think the better the learning. So it makes sense that they would test that in the interviews.
Yeah, definitely. It's interesting you say about CBL. What does CBL stand for? Is it the same as PBL?
I think there's subtle differences what they are. But so CBL is case-based learning as opposed to problem-based learning, but they sound pretty similar to me. Similar approach in that you're given a scenario and you're given quite a lot of freedom to explore that scenario, and then some learning objectives to make sure you don't completely miss the mark, but with a lot of freedom and a lot of independence to research and feed that back and communicate and work collaboratively. So is that similar to supervisions, or is it a different style altogether?
I think it is a slightly different style. Supervisions are more the taught, so they focus on the taught content from the lectures, and they will give you questions, or I guess they do sometimes give you problems and questions to take away that are based on the lectures, but we didn't do the sort of traditional PBL, like what would more be traditionally PBL, CBL. Cambridge doesn't really have a lot of that, which we did have one sort of student selected component where we had to go away and research something. And I found it really useful, and all of us were sort of saying, oh, why don't we do more of this? But I guess, yeah, that's just the course difference. I know Cambridge don't really focus on PBL. We did have, in biochemistry, we had like a little PBL project where we had to go away and research some genes, which I don't really think is what other courses do at PBL. I think it does it tend to be more clinical with other courses?
Yeah, I think again it depends on the course. For Bristol, our first year is all about the healthy body, and then our second year is all about the disease state. So first year, the cases would focus more on understanding, just general physiology, and then the second year, because we switched as well to symptom-based learning, so it's case-based learning but with a focus on symptoms. So you would on symptoms such as chest pain or breathlessness, and then you would explore everything around that. So you're really looking at the cardiovascular system or the respiratory system, but with a focus on the symptoms that arise when you have problems within it, which has been really interesting. I think there's so much information, there's so many different ways to go about it that as long as you're consistent in the approach, you're going to cover everything. You assume so.
Yeah, I mean, it is it's an overwhelming amount of information, I think, in your first couple of years. But yeah, I mean, that's one of the really good things that I like about Cambridge. Like, you do get small group teaching, you get one-on-one, but not one-on-one, one-on-three, one-on-two, one-on-three, and to ask those stupid questions that like you're being supervised by somebody who is like usually either an expert in their field or a doctor or a student in a higher year. And yeah, there might be little gaps in your understanding from the lectures, like or you might have a particular interest that you want to dive into a little bit more. So, yeah, I think it is really beneficial having those very small group teaching, which in my undergrad we didn't have that. we didn't really have small group teaching, so I've noticed a big difference from
I was going to ask,
the sort of depth that I using.
How do your experiences compare between the two degrees?
Well, they're very different, not least because Strathclyde is a like city centre, Glasgow uni. It doesn't have the collegiate system, funny enough. Sort of that's a very unique thing to Cambridge and Oxford. And yeah, they are very different experiences. I found the exams a lot harder in med school. I'm not sure whether that's because it's med school or whether it's because of the university difference, or also because I'm a little bit older and your brain's that little bit less spongy. So yeah, I found it a really different experience. I think the difference, there's a lot more content, I think, to learn. It's not necessarily harder, but there's just more of it.
I'd say that's been echoed by a lot of people, that there is just so much. And how have you found your kind of pharmacy knowledge? Is that, obviously it's like handy, but how much have you found it's helped, or actually are you learning it from a different angle? Like, how does it tie in?
Yeah, I mean, so because I did take 4 years between degrees, so I guess a lot of the minutiae that I would have learned in my undergrad, a lot of the molecular details sort of dissipated. A lot of them I'd forgotten totally. So I found going back to uni just that little bit older really difficult to start off with. And it took me a while to get into the swing of studying and finding what worked for me, finding different methods of studying. But I think that pharmacy really does help in clinical more than preclinical. So when you're taking a history from a patient and they mention, oh, blah, blah, blah drugs, like even if they pronounce it wrong, you know what they're taking, like because you've got such familiarity with, and yeah, I think that it does really help in clinical, and it helps with knowing the side effects. And so I think it's really helpful for clinical. For preclinical, I'm doing, so we do our pharmacology in second year, and I find that it is really helpful. Like I know all the drug names and I can remember broadly how they act, but sort of going into the minute detail again, I have to put a little bit more effort in again to sort of remember. But no, it definitely has taken some pressure off this year. It means I can focus more on like pathology and neurology and things. So yeah, it definitely has helped.
And do you find on your course that you're able to share your pharmacy experience, and do you then kind of get to experience the advantage of what everyone else is bringing in the course? Is there opportunity for everyone to kind of bring their experience?
Yeah, and I think that's one of the really good things about grad medicine. Like everybody's got their own thing that they can bring. I personally struggled with anatomy last year. It was just this, I'm sure you're the same, it's this minefield of muscle attachments, and it's a new language. But there was a guy who'd done a lot of anatomy in his first year, like he'd done a lot of in his first degree even, sorry. And it was really useful having him. And then in clinical environments, yeah, I think that I can sometimes have my little input of, oh, this drug does this, remember the side effects of this, or this and that. Like I love my little mnemonics and little ways of remembering things. And a lot of people sort of on the course remember the little mnemonics that I teach them. Like, oh yeah, that came up on the exam, Simon, and I remembered that you said this mnemonic that I'd basically learned my undergrad degree from mnemonics.
Yeah, that's really nice then, because because medicine is, big on peer-to-peer teaching and that sort of thing. So yeah, it's nice to be able to share, I suppose, your specialist knowledge. Do they have much, as you go through the years, do you think you'll get much opportunity to teach the years below at all? Is that something you're particularly interested in, or?
Yeah, so we already have, so this year we took the first years on like a little ward orientation. So we introduced them to their first patient, like watched them take a history and do like either a cardio or abdo exam. And it was actually really nice because you realize how much you sort of remember and sort of how much you know and that you've learned in a year. So yeah, I've had a chance to do a little bit of teaching. I took one of the first years onto the ward, and she took a history and then did a little bit of an abdo exam, and then we went and did a little bit of teaching about what can go wrong in the abdomen type thing. And it was really nice. And they do sort of really promote teaching and mentoring the years below. So yeah, that's one of the things I really like about medicine. I think there's more of a culture actually within medicine of sort of teaching and sharing than there was ever in pharmacy.
Yeah, definitely.
It is odd. Yeah,
I think because I don't know, maybe because you learn on the job a lot once you go to placement. Yeah, and I suppose lots of it you need when you're practicing examinations and things, it's hard to do by yourself, and half of the practice is just going through, you know, interacting with other people. So maybe that's what drives it. But yeah, it's an interesting point. It is very collaborative, or maybe it's just ingrained in the teaching style. Do you do, so Cambridge has an undergrad course as well, don't they?
Yeah.
Just checking. Do you have much to do?
Yeah, there's undergrad 6 years. Oh, what was it? Sorry.
I was going to say, do you have much to do with them at all? Because I was talking to someone from St George's, and they actually integrate a lot with the undergrad. I hadn't realised. So how does that compare at Cambridge?
Yeah, so we follow the undergrad course for the first 2 years. So we do all the preclinical with them.
Okay.
So at my dissection table, there was 8 of us at my dissection table, and 2 of us were grads, and then 6 were on the standard course.
Okay.
So you do get to interact quite a lot, and like I've got some really good friends who are on the standard course, like especially from my dissection table. We would, so all the colleges have like formals in Cambridge, so we would we took it in turns in first year to go to everyone's college for a formal from the dissection table. So we had a mixture of people from Wolfson, I'm at Wolfson College, we had some people at Christ's and at Churchill. So yeah, it's really lovely.
And is that the same for the supervisions? Are you mixed within those as well?
So supervisions, it took me age. I didn't understand this till I got to Cambridge. So the way the collegiate system works is you do your lectures and your labs with everybody, and then supervisions are based through your college. So there's the colleges tend to have like 10 to 15 students in them studying medicine, and you'll be split into supervision partners within your college, and then for things like dissection or biochemistry labs, you'll mix with all the other colleges.
Yeah. And because your college is specifically for graduate medicine, you're therefore with grads for supervisions. Yeah, okay. It sounds like a nice mix of meeting different people, but then having a space, I suppose, that's more grad med focused. Nice, okay. So outside of medicine, do you have any particular interests or hobbies? And you had obviously a very hectic mix with your A-levels. Is that something you still pull through in your life, or and how does that balance with medicine?
Yeah, it's hard to sort of balance, but you need those outlets outside of medicine. Obviously, like at the moment, nobody does anything. But I do. So I still play a lot of music. I play the piano and the whistles, like the Irish whistles, which is sort of, yeah, it's so important to have that thing to like chill at the end of the day. So yeah, music's like a really big thing. I've not really played much sport. I did rowing actually in first year, which is like a big part of Cambridge. But like since the pandemic, I've not really been able to row. Like row's totally been off. When I go to the gym, well, when I say I go to the gym, we've got like a bench and a bar and stuff in the house. Like that's like home gym equipment. It still counts, yeah. But yeah, I love traveling outside of COVID. One of my passions is sort of languages, and I'm trying to improve my medical French at the moment. Yeah, I was supposed to go on a course, the Anglo-French Medical Society. I don't know if you've heard of it.
No.
In Lille, but that was called off. So I was supposed to go there to do a medical French course. It's something that I'd like to pursue maybe my elective in a French speaking country. But certainly, yeah, I think you need something to unwind. You can't have just medicine in your life. It's you do need that little outlet, whether it be music or sport or knitting. I don't know.
Yeah. And so looking at your other interests, pharmacy, French, traveling, do they feed into any ideas you have about what future speciality you might like to do, or are you kind of open to something completely different?
Yeah, that's an interesting question. I mean, I really like the idea of having the option of working abroad, whether that be a French speaking country or somewhere else. I like the idea of doing that at some point. Whether that I'm not sure, to be honest. In terms of how pharmacy might impact it, I think that I am really interested in like the medical, like medicine, and I think that I probably would prefer a medical specialty to surgical, but I just don't really know. It is really hard to know at this stage. I guess specialties at the moment, it's hard to know. I really enjoyed my GP rotation, but I really want to get some more experience in like obgyn, because we've been doing all the science behind that, and it blows my mind totally. So and I follow a lot of obgyn Instagram pages where they videos of C-sections and all sorts, and it's just really interesting. So I don't know, I change my mind constantly.
Yeah. Every time you get like a guest lecture or you start a new module and you're like, oh yeah, this is cool, this is good.
No, my mind changes constantly. I did think about public health for a while, and I think it would be nice to have that at some point, to be able to have like a research or public health element to my career. But I don't think I think I'd like to do clinical medicine alongside it. I don't think I'd want to just do research, because I think I probably would miss the clinical side of things. So got a lot of time to decide. That's the great thing about medicine.
A lot of time and a lot of flexibility. I've spoken to medics who have taken 6 months or a year here, or they've taken up this post, or they have a split role between some research and some clinical and some teaching. So I think that's one of the best things about the career, is that there's a huge amount of flexibility and variety in what you can do. Okay, so just thinking of if you were to start again tomorrow, what would your top tip be? Like, what have you learned along the way that you would apply if you could start again?
Oh, do you mean start again as in?
I suppose for thinking more medicine focused, or if someone was to start medicine tomorrow, what would your top tip be?
Okay, I would say start using Anki.
Okay.
I wish that I'd used it from the word go, especially with anatomy. So and chat with people in the years above, see what's worked for them, because I guess every uni is different, and I guess just work hard, because I think that sometimes you forget that you do need to like work. You don't need to work like all day and all night, but just work constantly, do a little bit at a time, rather than just cramming before exams. And I think that making flashcards like Anki and Quizlet sort of really does help you to sort of pace yourself and yeah, and do little bits at a time.
Mhm.
And also, yeah, you need to make space for hobbies and do something fun alongside, or else it's just medicine's going to take over and you're going to hate it.
Yeah, I think, yeah, you have to position yourself in a place where you can keep consistently ticking away at it, but you don't feel like it's all consuming. Yeah, I think I definitely wish I had something like Anki flashcards, just because it brings up this such, we said, broad amount of information that unless you just slowly keep seeing it, it is a lot to try and fit in a small space of time. As a serial crammer, it's been a learning curve for me.
Yeah, and I think that's one of the differences between a medical degree and, I think, my undergrad I was able to cram, and A levels.
Yeah.
You get used to it, but I think with medicine you just can't. There's such breadth that you can't cram, so you just need to chip away at it. And it's not necessarily difficult, but some of it is. But yeah, you need to take it at a pace rather than cramming.
Yeah, and kind of you need the skills along the way as well, so when you're practicing examinations, you need to be familiar with, the anatomy and the terminology there in that moment. It's not just about exams, you're using it. And I suppose when placement comes along, that will be a bit more obvious because you're utilizing it day to day. But you're not learning for exams, you're learning for for your job, for your vocation. So yeah, definitely, try and keep on top of little bits each day.
Yeah, no, definitely. I totally agree with that. One thing that I would also, I started teaching either myself or my dad. So I would make little videos to teach myself or teach my dad a topic that, say there's a topic that you really struggle with conceptually. I think it's really good to try and teach somebody to test whether you know it. And I'm lucky my dad's a biology teacher, so he does have an understanding of a lot of things. And I just say, right, ask me questions of things that you don't understand and make sure so I think teaching is a really good way to test whether you know something and how well you understand it, and it sticks. Once you've taught somebody, it sticks a lot better than just rewriting your notes. So
yeah, there's some things that you have an idea of, but having to articulate it shows you where your gaps are. So yeah, I think that's great advice. Well, thank you so much for spending some time today, sharing your journey and giving so much information about the course at Cambridge. So I know you said that if anyone has any particular questions, I'll put your details below, and people can get in touch and hear some more information. So yeah, thank you so much. Enjoy the rest of your Easter, and yeah, good luck in third year.
Oh, thank you very much. Yeah, it was an absolute pleasure.
Perfect. Thank you. Bye-bye.
Thank you.